Hello guys. So today we are going to start with the topic antiseptic and disinfectants. This is the topic number 29 in the book of Bobyrov. So guys, let's start. So first of all, what is an antimicrobial agent? So these are the drug for the treatment and the prevention of the infectious diseases. So these are basically divided into the disinfectant, antiseptic and chemotherapeutics. So guys, what is disinfectant? This is an drug which utilize their antimicrobial property in the environment which is outside of the body. Okay guys, thereafter what is antiseptics? So this act on the surface of the body. These are disinfectant. And thereafter chemotherapeutics. These exert the effect inside the body. Okay, so then let's start with the topic. Thereafter, let's talk about the antiseptic and the disinfectant. So, what is a good antiseptic and disinfectant? First of all, it must be so antiseptic and disinfectant. So, how can I say that any antiseptic or disinfectant is good? So, it must fulfill all these conditions, which are as first of all, it must be having some bactericidal action. Thereafter, it must be chemically stable. Thereafter, it must be of rapid action. Thereafter, it must have lack of absorption. Thereafter, it must be having low toxicity. Thereafter, the efficacy in the presence of different organic substrate such as pus, blood, sputum. So the efficacy must be high in pus, blood or sputum. So, and what else guys? It must be having absence of the allergic properties. Thereafter, the absence of irritant properties. So this is the guys classification of the good antiseptic and disinfectant. And thereafter guys, let's move towards the classification. And before that, let's see what are the three main mechanisms of the antimicrobial or antiseptic or any disinfectant. So the first mechanism of action of any say antiseptics or disinfectants. So it must be working in either one of three mechanism. So by the denaturation of bacterial protein including enzymes. What other option can be possible guys? By the oxidation of bacterial protoplasma. And what third can be possible guys? That's the changing of bacterial membrane property. Okay guys, thereafter let's move towards the classification. Okay, So let's do the classification here. So it can be classified as, according to the Bobyrov book, it can be classified as inorganic, and the second type is organic. So guys, let's move in inorganic. First of all, the first one is here. First one is halogens. Thereafter guys, what are these? These are next one are oxidizing agents. Thereafter guys, the third category is about the metallic salts. And the fourth category is about acids and alkalis. And guys, what are the halogens, or what compounds are in the category of halogens? These are first of all iodine alcohol solution. Second one is povidone iodine. Third one is idicylin. Thereafter chloramine. Thereafter chlorhexidine. And what are the oxidizing agent guys? These are only two. It is the hydrogen peroxide, and the another one is the potassium permanganate, so KMnO4. Okay guys, thereafter the metallic salts, what can be possible here? So this is the mercury dichloride, thereafter yellow mercury oxide, thereafter guys silver nitrate, copper sulfate, thereafter zinc oxide, thereafter zinc sulfate. Okay guys, thereafter in the acid and alkalis we have the boric acid, thereafter salicylic acid, and at last we have solution of ammonia. Okay guys, so this is the whole classification of your inorganic substances. Let's move towards the organic one. So in organic, okay, let's use this color. In the organic substances, we are gonna having first of all the aldehydes. It is consisting of what? Formaldehyde. Another one is the hexamethyl antiramine, or it's also known as urotropin. Another one is the alcohols. It is consisting of what? Only one, ethyl alcohol. third one is Phenol Derivatives. It's consisting of phenol and resaconol. Second one is resorcinol. Thereafter, about the dyes, that is the Methylene Glue. Second one is Brilliant Green. And the third one is Erectidine Lactate. Thereafter, guys, after the dyes we have detergents. In this we have etonium, second one is dicamethioxine, third one is pyramazine. Next category is about tar, resins and products of petroleum. And it consists of birch tar, second one is H-thiol, third one is liniment after Vishemki. Next one is nitrofuran derivatives. It consists of nitro, furazone. Next one is the antiseptic from the medicinal plants. It consists of what? Chlorophyllipate. Next one, novoi, mannan. Thereafter, at the last category is combined preparation. Consists of tristyllium and cutaspate. Okay guys, now let's start talking about our first halogen. Or let's first talk about the oxidizing agent according to the book. So guys, the first and the foremost is our hydrogen peroxide. So what we should know about this, so first of all, it is based on the action of hydrogen, it's based on the release of the oxygen atoms. So when the oxygen atom gets released, so it basically traps out the bacteria, or like it basically oxidizes the bacteria, so finally resulting in the killing of the bacteria. And so it will also produce the foam, and it is used for the mechanical cleaning of the wound. And what are the indication for this medication, guys? What are the medication for the hydrogen peroxide? Is for the processing of the wounds. It's for the processing of wounds. Thereafter, processing of impaired skin. Thereafter, gargling or mouthwash. Okay guys, so these are the indications for the hydrogen peroxide. Thereafter, what else can be here? The else can be possible as the capillary bleeding. Thereafter, the depigmentation of teeth. What I mean by the depigmentation of teeth, guys, there are some guys who are having the yellow teeth, right? So just to like decolorify them, just to make them white again, so we also use the hydrogen peroxide. Thereafter, let's move towards the other one, that's the potassium permanganate. So for the potassium permanganate, guys, it's also like having the among the same effects. It's also having the same mechanism such as the releasing of the oxygen. Thereafter, the like free radical mechanism, it work on that principle too. Again, it is having the indications such as the irradiation of the purulent wounds. Let's write it here. So for the or say the cleaning of wounds. Thereafter, like the curling and the mouthwash again. Thereafter, it is also used for as a syringing in gynecology. Thereafter, in the processing of burns. Thereafter, what the last is, it's for the lavage of the stomach. In in the case of acute poisoning. With what poisoning? It's with the either it's with the morphine, alcohol, alkaloids, etc. Okay, guys. Thereafter, let's move towards our first category, that is the halogens. So first and foremost of them is about the iodine alcohol solution. So what we should know about the iodine alcohol solution, guys, it's important here. So about this, we must know that it's also having the oxidizing properties. So it works as the oxidizing of protein. Thereafter, halogenizing of protein. Thereafter, irritation of the skin and mucous membrane. Right, guys? So, and these actions are concentrated within the bactericidal action. And what are the indication? It's all about again the cuts on skin. Thereafter, during the surgery skin area. Surgeon's hands. It's like now before surgery. Thereafter, this is in the disease of muscle and joint. Okay, guys, and what if the toxicity occur? If the toxicity of the sodium or of the iodine will occur, then we can neutralize by the sodium thiosulfate. This is what you need to know about these points. Thereafter, let's move towards another drug. And what the another one is the povidone iodate. And just guys think like most of the drugs are having about the same action, so I will just gonna repeat them. So again, the povidone iodine, it's a chemical compound of the provine, hydrogen iodide, and elemental iodine. It works by the iodine releasing with the following bactericidal effect, exhibit longer lasting antiseptic effect than the teacher of iodine. So guys, it is having more efficiency because it is lasting longer, right? Thereafter, guys, it is also used for the pre and the post-operative skin cleaning. Again, same. Thereafter, it's for the treatment and the prevention of the treatment and the prevention of the infection in the wounds. Thereafter, ulcers, cuts, and burns. In gynecology, for the vaginitis associated with the candida, trichomonal or mixed infection. So, guys, it's used as for the fungal infection also. And guys, just can you notice one thing here? The most of the uses here, it's above the it's or the topical effect. It's here, right? So it's the topical effect again. That's for the candida, trichomonas, and what guys? Candida, trichomonas, and mixed infections. Okay, guys. So it is contraindicated with the disease with the patient who is having the thyroid diseases or who are taking the thyroid medication. That's it, guys. Thereafter, hydrocytin. But hydrocytin is the combined combination of iodine and diamexid and glycerin, and due to the content is due to one of the contents dimexide, it has increased antiseptic activity and penetration through the skin. It is for the treatment of skin diseases, ulcer, wound, and may be used on the mucous membrane due to less irritation. And it can also be used in otitis, tonsillitis, and chronic atrophic rhinitis, periodontitis, and vaginitis also. Thereafter, guys, the another one is the chloramine B. It is an organic compound containing chlorine. It is transformed into the hydrochloric acid, which decays into chlorine and oxygen. Thereafter, guys, the main thing to understand is it's rarely used for the treatment of pus wounds. It's for the basically for the non-metallic instrument, and it also for the processing of the skin. Chloramine B. Thereafter, chlorhexidine. It is an organic chloride containing preparation with detergent properties. It has antimicrobial and antifungal activity. Okay, guys. Thereafter, it may improve regeneration. It is used for the treatment of wounds, for gargling, and individual prophylaxis of the STDs. It is also used for the processing of surgeon hands and surgical area, and it's for the quick sterilization of the instruments. Thereafter, guys, what should be the next? It should be the next one is about the acid and the alkalis, right, guys? So about the acid and alkalis, we know there are the three things here. That's the boric acid, salicylic acid, and the solution of ammonia. So about the boric acid, it's used for the minor burns, for cuts, acne, and the prevention of the athlete's foot. Okay, guys, so there can be a question also, which is the what is the prevention of the athlete's foot is by? So the athlete's foot prevention is by the boric acid. Okay, guys, thereafter the treatment of vaginitis, candidiasis, and it's also used for the treatment of the external otitis. It is applied in the very dilute aqueous solution as eye drops in bacterial conjunctivitis. Okay, guys, so the next one is the salicylic acid. It has an antimicrobial action, an anti-inflammatory effect. So let's just write down here: antimicrobial, anti-inflammatory effect, and keratolytic action. What it means is like the upper layer of the epidermis, it removes that one in the big doses, and in the low doses in the high doses it decreases the upper layer, and in the keratogenic action in the lower doses. Okay, guys, and the last one is about the solution of ammonia. It is an antimicrobial. It is a weak detergent, irritative, and reflexive action, and is used for the processing of surgeon's hands. Again, guys, the question is here: what is used for the preparation of the surgeon's hands? That's it, guys, and this is our last our last acids and alkalis, and the last one is of this category is about the metallic salts. So guys, what is the mechanism of action of the heavy salts is about? It binds to the SH group. Thereafter, it inactivates the enzyme and the precipitation of the proteins. So that's how it shows its antimicrobial action. Okay guys, so the first and the foremost here is about the mercury dichloride. It also has an bactericidal effect, which is decreased at the presence of proteins, and the main thing is guys, it's very toxic. So guys, just tell me, can you take any medicine which is very toxic? No, we cannot digest that medicine, right? So it's just for the disinfection of clothes and the washing of the non-metallic instruments, mercury dichloride guys. Thereafter again guys, there is the yellow mercury oxide. It's must also be very toxic, right? Because there is mercury in here, so it's not soluble. It is used in the form of ointment of the treatment of pyoderma and psoriasis, seborrhea, and pediculitis. Yeah, so let me just write it in the front of this. That's pediculitis. Thereafter, what is thereafter the pyoderma? Thereafter, pediculosis. No. Thereafter, we already wrote the pediculosis, right? Thereafter, seborrhea. Thereafter, psoriatis. The other one is guys the silver nitrate, copper sulfate and zinc oxide. But the silver nitrate, it is used for the treatment of ulcers, right guys? Thereafter, uh, erosions and granulation. Okay guys. Thereafter, it is also used for the treatment of throat, urological and gynecological disease. So throat, uro and gyne disease. In the copper sulfate, we talk about it's used in the chemical burns caused by white phosphorus. By white phosphorus. Okay guys, after zinc oxide and zinc sulfide, about this point we just need to know about it. Both of them are having an antimicrobial and astringent properties. Thereafter, both of them are used in eye infection, thereafter burns, wounds and skin diseases, and it's applied in ointments, both of them. So again, as an antimicrobial, astringent and topical disease specifically. Okay guys, so now we covered our whole part of the inorganic astringents. Thereafter, let's move towards the organic one. Okay guys, so the first and foremost here is about the aldehyde, right? So about the aldehyde, we think about the formaldehyde, right? So what is formaldehyde guys? So it acts on the spores of bacteria and fungus. So acts on spores of bacteria and fungi. So what happened here is guys, though by this action it has an bactericidal and fungicidal action, right? So it dehydrates the proteins and tissues, so it is also having an what mummifying action. So always remember guys, you maybe like you guys must have visited the anatomy lab, right? Anatomy lab. So the solution in which an cadaver is kept, that is what, nothing more than a formaldehyde. Okay guys, or it's well known as what, formalin, remember. So that's how it comes. And guys, thereafter, what are the indication here? The indication is about the free sweating, thereafter syringing again, right? And sweating free, or the free sweating, that is so better. Thereafter in what? In the syringing, in gynecology. Thereafter what? Disinfection. Thereafter conservation of vaccine and serums. Thereafter the conservation of anatomic preparations, right? And what about the toxicity, guys? If somebody is having the toxicity of formaldehyde, what we must give? We must give us a weak solution of ammonia. Right, guys? Okay. So the next one is about the hexamethyl antaramine. So again, guys, it's a derivative of formaldehyde. Okay. So it's a derivative of formaldehyde. It's administered IV. Okay, guys, and orally. Thereafter, it forms into the formaldehyde in the organism. It is used for the treatment of infection of urinary pathways, cholecystitis, and as well as decrease in intracranial pressure in meningitis or encephalitis. So let's just write it here. So about the cholecystitis, urinary pathways disease, or the UTI. Let's just write the UTI. Okay. Thereafter, what is in the encephalitis? Okay, guys, the next one is only about the ethyl alcohol. So as we all know that the alcohol's mechanism, it's directly related to the inhibition of oxidoreductase mechanism, right? So let's write it here, oxidoreductase mechanism, and it's connected with the dehydration also and the precipitation of proteins. It also results in a bactericidal action. Bactericidal action. And what, guys? It has an antiseptic effect. Yeah, that's it, guys. And it's again for the processing of the surgeon hands. Processing of the instruments. Thereafter, the compresses. Next, guys, let's talk about the phenol derivatives. So the mechanism is by it block dehydrogenases. It denaturates the protein and damages the membrane of the bacteria. Bond between phenol and protein are not strong, and one molecule of the phenol can interact with the few protein molecules by turn. Phenol has a bacteriostatic action at a low concentration and bactericidal action in the bigger concentration. So let's write it here. Bacteriostatic action in the low concentration and the bactericidal in high concentration. And we are talking about what? We are talking about the phenol derivatives or the phenol. Okay, guys, it's here. So the indication, again, the indication is all about the this. Okay, let's write it here. What? Disinfection, otitis, thereafter some form of the rhinitis, thereafter infection of oral mucosa. Right. And thereafter again, guys, phenol is very toxic. Very toxic, guys. Okay, so let's make a screen here. Just remember it in this way. Phenol is very toxic, and you know, like what? There is no specific therapy for the phenols. Toxicity. Okay. So let's just talk more, little bit more about it, about the aromatic preparations. Okay. So yes, we have some more. right? So about the other aromatic preparation, it may also consist of the resorcinol. It is used for the treatment of skin diseases such as the eczema, seborrhea, and itching fungal diseases. Thereafter, esthiol. Esthiol is a dense liquid of dark color. It right. So now we are talking about, like, see guys. So there are some groups which are interrelated, right? So the phenol derivatives are somewhat also related to the tar preparations. So this is here, right? So as you can see guys, I was talking about the ethyl, right? So it is again the liquid of the dark color, right? So and it's used for again it's from the group what? It's from the tar resins, right? And the products of the petroleum. So it's basically used for the as an insecticide action. Again, let's write it here. Let's write it here. What it does is insecticide action. Thereafter, what it does is it also has an antiseptic property and it decreases inflammation. Thereafter, guys, what? It also decreases the pain. And the same with the Bistar also. You can just join the same words here, which I said. Thereafter, the Vishensky, right? And Bistar again. It's like the let's have a little bit word about the Bistar. About the Bistar is a product of sublimation of birch bark. It's like a dense oil-like liquid of black color, contains aromatic compound, and it has an antiseptic properties, an insecticide action, and an irritating keratoplastic action. It's used in the skin diseases, and it's also a direct ingredient of lintment after Vensky. Okay, or the balsamic. Let's write the balsamic lintment of the Vrishki. Okay, guys. Here is it is here it is. So okay guys, we now we have just three groups left. That's the dye dyes, detergents. Oh, we have here also nitro from derivatives, antiseptic from the medicinal plants, and combined preparation. So now let's talk about the dyes. It's about the methylene glue. Okay, so again the methylene glue, it's the for the processing of burns, pyoderma, disease of the mucous membrane, and the oral cavity. Okay guys, so just write it here, the pyoderma. What is the full name of the pyoderma, guys? It's the pyoderma gangrosum, or it's a kind of, okay, so it may process to the pyoderma gangrosum also. So that's for the sake of completion, just write the pyoderma. Thereafter the burns. Thereafter the disease of the mucous membrane, or let's use just this thing, okay, of mucous membrane. Okay guys, thereafter what else? And it's also for the washing of urethra and the urinary bladder. And you know what guys, why it's important? Because it's used for in the poisoning of cyanides, right? Because cyanide is obviously very toxic, right? So it's used in the as an antidote of the cyanide. And what else? And the nitrates and aniline derivatives. Okay guys, thereafter the another one is the brilliant green. Brilliant green is basically for the staphylococcus, just right here, staph infection. Thereafter it's used again for the pyoderma, skin pustules, pyoderma, skin pustules. Thereafter cuts, and what else? And the last we have varieties. Okay guys, thereafter the last one is the etagridine lactate, right? So in etagridine lactate, it's again act on the strep infection, right? It again act on the strep infection. It doesn't irritate the tissues, okay? like so negative effect, like or the negative, like irritation of the tissues. Thereafter, guys, what we need to know about it, it's used for the treatment of wounds, conjunctivitis, and and the mouth diseases. Okay, so it's used for the treatment of the conjunctivitis, mouth infection, say, or the oral cavity infection. And what else, guys? It's used for the washing of cavities also. Okay, guys. Then what else? What is the next category? What we must talk about? It's the detergents, and the detergents we have etonium, right? And about the etonium, it's an quaternary ammonium compound. Okay, guys. Ammonia. So always remember, guys. Like remember, right? So the ammonia was also having what, a weak detergentic action also. So it's an catagenic detergent. It has an antiseptic action again, stimulates regeneration, cause local anesthesia, decrease intoxication, and it's also used for the treatment of wounds. What else it can be used for, guys? Again, just remember, like the most of them are the common, right? Ulcers, right? Tropical dermatitis. Remember. Thereafter, what else? Radiation and eye disease. Thereafter comes what is the next step? Decamethasine. It's again the quaternary ammonium compound. Thereafter, what it does is it acts as an detergent, and its pharmacological activities again same to the etonium, which is just here. Okay, guys. And it's also used for the surgeon's hand, but just remember, guys, what is important, the iodine and the ammonia, that is the most important as for the surgeon's hand, right? So for the surgeon, for like, let me just write here the surgeon's hand also, that's in a small way. Thereafter, what else? Surgical instruments, sterilization. Thereafter, what, just about the irritation of the bronchi. And what else, guys? Washing of cavities. Beramystin, then it's again, guys, the same as above, but just like listen to the explanation here. It's about based on the direct hydrophobic interaction with lipids of microorganism membranes. It also leads for their to their fragmentation. It increased permeability and cytolysis. It acts on bacteria, viruses, and fungi. Indication to use include treatment of infected wounds and burns. After prevention and treatment of postpartum infections such as inflammatory disease of the genital organs, treatment of skin and mucosal candidosis, foot mycosis, individual prevention of STDs, combined therapy of acute and chronic otitis media, sinusitis, tonsillitis, periodontitis, thereafter stomatitis, periodontitis. In some cases, a brief burning sensation, itching, hyperemia, and dry skin are possible. So that's how we conclude our point on the detergents, guys. So what we have next is about the nitrofuran, and about nitrofuran we have nitrofurazone. It mechanism of action is it inhibits carbohydrate metabolism, so it's also having different part. So it inhibits the carbohydrate metabolism, and for and the respiration in bacteria. It also has an bactericidal and the bacteriostatic action. What are the indication, guys? Purulent wounds, ulcer, burns, irritation of cavities, gargling, otitis, skin pustules, and conjunctivitis. Guys, see, most of them are having the same. Let me just write them for once and for all. That's just here. And those are what? Those are, see, otitis, conjunctivitis. Thereafter, what, guys? Irritation of cavities. thereafter gargling, thereafter skin pustules. Okay guys, and the last there we have only two group left, right? Yes, antiseptic from the medicinal plants and the combined preparation. So peroxide is a mixture of chlorophyll from the eucalypt used in the form of alcohol or in the oil solution, mainly act on coccus such as streptococcus. Okay guys, thereafter especially on the staphylococcus, and it's also applied on the treatment of wounds, burns, trophic ulcers, erosion of the uterus, cervix, irrigation of the cavities, may be used in the IV, in sepsis or pneumonia, caused by staphylococcus, and it also causes allergy. Thereafter, the next one is again, guys, what? Our Novoiminium. It is an antiseptic from the herb of Hypesium, the St. John's wort, act on gram-positive coccus. It is used topically for treatment of wounds, burns, abscess, etc. Last one is about the guys Stylium and Cuposect. Stylium it itself tells the name like what? Strile. So it's again for making strile again. It contains ethanol 81 to 89%. So ethanol is a major compound here. And for the moistening, softening and protecting of compounds for the skin, thicker, flavor and water. It also has an bactericidal, fungicidal and virulocidal action, reduces transient and resident skin microflora, keeps the action for 1 hour on the skin, 3 hours in the gloves, provide anti-precipitant action. Thereafter, guys, you just paid attention one thing. What I said, the 1 hour on the skin and 3 hours inside the gloves. Why? Because see, it's ethanol, and ethanol is what? It's versatile in nature, or the it like evaporates very quickly, right? So just to inhibit that, we wear with gloves with it, right? So in gloves it will stay for about 3 hours in gloves. Okay, so guys, right, it doesn't irritate the skin. Stylium gel is designed for the treatment of hands of the medical personnel, worker of pharmacies, child institution, food industry enterprises, etc. It is can also be used for carrying newborns, old people, patient during traveling, or rapid disinfection. Thereafter, guys, the last one here is Cutacept. See, cutaneous sept for the disinfection, right? Let's just talk about it. It contains 2-propanol, benzalkonium chloride and water. It has bactericidal, fungicidal and virulocidal action. The area of application is pre and post-operative treatment of skin and wounds, treatment of the skin before injection with removal of seams, or the replacement of the bandages, and minor injuries and excimus lesions. So that's how we conclude our lecture on this part, guys. See, just remember this table. The superficial table is the most important here. The classification here. See, you can just take a screenshot here. Okay, guys, that's the important part, and you just don't need to memorize a lot of it. What you may need to memorize is just like the important things, about the alcohol, like the iodine part here, right? Halogens, oxidizing agents. Thereafter, some metallic salt you need to know, right? Thereafter, the acid and alkalis. This part is more important here. Thereafter, guys, what's important here? That's all about the dyes. It's important. Thereafter, aldehydes, alcohol, and the phenol derivatives. You just need to know, like the theoretically about these guys. It's not that much important here. Okay, guys, but still, if you want, you can just like study it for your own good. And that's it, guys. Thank you.